Hi, everybody. I wanted to talk about something I think a lot of cancer patients don't talk about is the sense of grief when a medication stops working. So I've been on Ibrance and letrozole for about 3 years, and it was a great run. Very few side effects. It worked really well, kept things asleep for a long time. And then about 6 to 9 months ago, things started kind of like popping up. I'm like, well, was that really the cancer? Is that my autoimmune? And it's the cancer. So, after I had my scan, a lot of us who get our PET scans, we have something called scan anxiety, which is we're nervous. Like, oh, is the cancer back? What's it going to mean? What's my next treatment going to be like? I don't know. There's a lot of stuff that goes through our heads. So I'm making this video really more for the people who live with us, because people don't really understand what goes through our minds and why we get kind of moody when we do. But so I noticed a few days after I had my scan, I already knew that the scan results weren't going to be that great. I already knew. I could feel the lymph nodes. I can feel the lymph node swollen. It's cancer. It's been growing there for the last few months. It's been growing, so I know it's cancer. So I knew this scan wasn't going to be good, and I kind of felt depressed, going, you know, I've been lucky with this Ibrance. It's treated me well. My blood hasn't been bad. I haven't had biopsies, and now I have to stop it. I have to stop using it because it's not working anymore. And the next medication I'm supposed to be on for my cancer, which has a mutation, a PIK3CA mutation, it has terrible side effects for some people. Three main side effects are high blood sugar, a terrible rash, which makes you very itchy, and diarrhea, the runs. So not everybody gets those, but they're not nice. And a lot of people do get those three main side effects. There are other side effects, but those three really are unpleasant from what I've been reading in our support group on Facebook. So, but what has helped me prepare for this is I've been a part of support group before I started my medication. So I'm going to be starting this new medication in about 2 weeks. And I've been on listening to this group for about 3 months. And I know what to expect. I know how I can help myself prepare for it. And I think that is something as a caregiver or a spouse or a significant other you can do to help your person going through cancer is to help them find a support group to learn as much as they can about the illness and the new medication, so that they're not wondering, going, oh, what about this and what about that? And ask your doctors. If you have email with your doctor, email your doctor questions or call and make it a phone appointment with your doctor and ask questions. But there is a small amount of depression associated with basically the loss of that good medication that had worked for so long. So it's important to understand that. And now that I'm starting a new medication, I'm going to be a little anxious. But I have to remember that, I'm a firm believer on what you think about, you bring about. And I don't want to think about having high blood sugar or the rash or diarrhea. I'm going to think, I'm going to feel good, I'm going to eat good, I'm going to stay active. And yeah, maybe I'll have a little bit of adjustment period, but that's normal. So, it's a lot of it has to do with mindset, not letting fear take over. So if you're supporting somebody who has cancer, is going through cancer treatment, help them find support group to learn and talk to other cancer patients. Facebook has a lot of groups. I'm not sure there's lots of other media groups that are out there. I just use Facebook because it's easy for me to use. But definitely, there is anxiety and a little bit of depression sometimes associated with changing medications. For me, it was mine. I just kind of felt icky for a few days. Like I just didn't feel me. And I think I know why. It's because I know that I'll be changing medications to a more unfriendly medication for some folks. So anyway, I thought that might be helpful for some folks out there. If you have any questions, please ask. I'm happy to ask. If you think this video will be useful for somebody else, please share. I'm happy to, share my videos with anybody who wants to hear. Because that's why I'm doing these videos. I do it for people who might wonder what it's like, or might wonder how they handle these problems. Anyway, stay happy, stay healthy, live life, and find joy. Bye-bye.